Hi there, students, and welcome to Crazy Nurse RN channel. I'm Crystal Merducanes, nurse educator teaching fundamentals of nursing practice. If you have any question or if you want to clarify some gray areas with regards to the topic that we have today, please comment down below. I'll be glad to answer your questions and read your comments. Also, if you want to suggest any topic or content for our next videos, please also write them below. And if you find this YouTube channel useful, please click the subscribe button and hit the notification bell to keep you updated for new video uploads. So today, our topic is about sexuality. So what is sexuality? It is an individually expressed and highly personal phenomenon that involves from life experiences. It is about your sexual feelings, thoughts, attractions, and behaviors towards other people. You can find other people physically, sexually, or emotionally attractive, and all those things are a part of your sexuality. Development of sexuality. Okay? So it begins with conception and continues throughout the lifespan. So we have here birth to 12 years old, adolescence, young and middle adulthood, older adulthood. So for the period of birth to 12 years, so we have two things that happened here. We have your masturbation and your menstruation. So for your masturbation, it happens by the age of 3. This is the excitation of one's own or another's genital organs by means other than sexual intercourse. Okay? For your menstruation, it is a monthly uterine bleeding for girls, okay, or for females. So adolescence. So we have here dysmenorrhea. So it is a painful menstruation which is prevalent among adolescent females. Now let's go to your young and middle adulthood. Young adulthood, intimate relationships form with long-term implication. However, for your middle adulthood, both men and women experience decreased hormone production, causing climacteric and menopause. Okay, when we say climacteric, it is the period in the life of a man chiefly characterized by diminished sexual activity. However, your menopause, it is when it's a year since you had your period or your menstruation for women. It is a cessation of your menstruation. So it is defined as the time when there has no menstrual periods for 12 consecutive months and no other biological and physiological cause can be identified. So that is your menopause. For your older adulthood, define sexuality far more broadly and include in their definition such things as touching, hugging, romantic gestures, comfort, warmth, dressing up, and joy, spirituality, and beauty. So as you notice, sexuality for older adulthood is more on a deeper attachment or deeper relationship. Okay, that's how they define their sexuality in this period of your lifespan. We have also here sexual health. So it is an individual and constantly changing phenomenon, falling within the wide range of human sexual thoughts, feelings, needs, and desires. So it is a state of well-being in relation to sexuality across the lifespan that involves physical, emotional, mental, social, and spiritual dimensions. Okay. So, in a nutshell, it is a state of health or a state of well being involving your physical, emotional, mental, social, and spiritual aspect in relation to your sexuality. Okay, so that's your sexual health. There are components of sexual health. So we have your sexual self-concept, body image, gender identity, gender role, behavior, and androgyny. So we'll be discussing each one of these in the following slides. So for your sexual self-concept, it is how one values oneself as a sexual being. So it determines with whom one will have sex, the gender and kinds of people a person is attracted to, and the values about when, where, with whom, and how one expresses sexuality. So that's your sexual self-concept. We also have your body image. So it is a central part of the sense of self and is constantly changing. Okay. For your gender identity, it is one's self-image as a female or male. More than just the biological component, it also includes social and cultural norms. So it is more of your identity, okay, as a person based on the based on social and cultural norms. This is how you regard yourself when it comes to gender identification. Gender role behavior. So the outward expression of a person's sense of maleness or femaleness, as well as the expression of what is perceived as gender appropriate behavior. So this component focuses more on the behaviors or the characteristics that a particular individual express or portrayed in a social environment. We also have your androgyny, so also known as flexibility in gender roles. The belief that most characteristics and behaviors are human qualities that should not be limited to one specific gender of the other. So the key term for androgyny is flexibility. Okay, you are flexible to uh, to any or to either gender roles. Okay, that's your androgyny. Varieties of sexuality. So we have your sexual orientation, your gender identity, erotic preferences. So for your sexual orientation, it is one's attraction to people of the same sex, other sex, or both sexes. So we have here LGBTQQ. So L for lesbian. These are female homosexuals. We also have gay. So the gay term here refers to a general homosexual state. Okay, so a female homosexual can be considered as gay. A male homosexual can be considered as gay also. Okay, so remember that one. Bisexual, if the person is both attracted to male and female. Transgender, queer, and questioning. So these are the six sexual orientations identified. Okay, aside from being a heterosexual being, okay, heterosexual orientation. So we have 2, 4, 6. Okay, we have six other sexual orientation. Next, we have your gender identity. We have your intersex. Okay, there are contradictions among chromosomal sex, gonadal sex, internal organs, and external genital appearance. Okay, so the problem here is in the anatomical structure of the person. Okay, there are some altered or altered chromosomal. This is more of a genetic problem. Okay, more of a body problem that is not congruent to the gender of a particular person. For example, we have hermaphrodite, okay, and other defective defective organs, okay, So that could be incongruent to the gender identity of an individual. We also have your transgenderism. Sexual anatomy contradicts gender identity. Okay? For example, if a person is a male biologically, however, he identifies himself to be a female. Okay? So there is a strong contradiction between the sexual anatomy and the gender identity of that person. So that is transgenderism. And under that, we have a gender identity disorder. So this is called your gender dysphoria. So it is a strong, persistent feeling of discomfort with one's assigned gender. So if an individual is uncomfortable with his or her own assigned gender with strong and persistent feeling, so he might have a gender identity disorder known as gender dysphoria. We also have cross-dressers, okay? Dressing in the clothing of the other sex. It makes individuals' outward appearance consistent with their inner identity and gender role. So this means a person covers up his body or his appearance so that the gender identity that he has will be congruent on the appearance that he will be presenting in the public. Okay, so that's your cross dressers. We also have erotic preferences. We have your oral genital sex. It is known technically as cunnilingus. Okay, it involves kissing, licking, or sucking of the female genitals, including mons pubis, vulva, clitoris, labia, and vagina. Okay, we also have a term called fellatio. Okay, it is an oral stimulation of the penis by licking and sucking. Another erotic preference is your anal stimulation. Anus has a rich nerve supply. Stimulation may be applied with fingers, mouth, or sex toys such as vibrators. Lastly, we have genital intercourse. Okay, penile vaginal intercourse is known as coitus. Okay, coitus is a medical term for intercourse or sex. Can be both physically and emotionally satisfying. So we have here factors influencing sexuality. So we have family, we also have culture, religion can influence sexuality as well, personal expectations, and ethics. Okay, so these are the four factors that could influence a person's sexuality. We also have your sexual response cycle. So we have phases here. So the first phase is your desire. Okay, it is a conscious sexual desire. It starts in the brain. Next, we have your excitement phase. Okay, it involves two primary physiological changes under your vasocongestion. So there is an increase in the blood flow to various body parts, and it stimulates your sensory receptors within these bodies. Okay. Next, we have your orgasmic phase. It is the involuntary climax of sexual tension accompanied by physiological and psychological release. Okay? This is a heightened emotion in your sexual response cycle. And lastly, we have your resolution phase. It is the period of return to an aroused state, may last 10 to 15 minutes after orgasmic or longer if there is no orgasm. Okay, so these are your sexual response cycles. So it has 4 phases. So I have here a graph representing the phases of the sexual response cycle, and it is divided into two. We have the male and the female sexual response. For your male, in the blue line, so we have here a increased a sudden increase of your excitement phase. Okay, however, a plateau there is a plateau stage in the middle of your excitement phase. Then after that, it will escalate. Okay, it will escalate rapidly until it will reach your orgasm phase or orgasmic phase. Then once a male individual has achieved the orgasmic phase, it will suddenly drop down. Okay, his heightened emotion will suddenly drop down. So that is called your resolution phase. Okay. On the other hand, females do have a constant excitement phase until she reaches the orgasmic phase. And once the orgasm or the heightened emotion is reached, it will slowly and gradually decrease. Okay, that is your resolution phase. Okay, so the main difference between your male and female sexual response is in the resolution phase. Okay, for males, they experience a sudden drop, okay, of resolution phase. There is a sudden drop of their heightened emotion from the orgasmic phase. Then for females, they have a gradual or slowing down of their heightened emotion or their orgasm. Okay, so that's it. So now we have here altered sexual function. So it can be caused by your past and current factors, sexual desire disorders, sexual arousal disorders, orgasmic disorders, sexual pain disorders, and problems with satisfaction. So we'll be discussing each one of these in the following slides. So for your past and current factors, we have your socio-cultural factors, your psychological factors, okay, the way you think, okay, could really affect your sexual experience or your sexual activity. We also have your cognitive factors. So if you have problem with regards to your cognitive function, so it could negatively affect your sexual experience or your sexual response. Sexual problems, lack of intimacy and feeling, health factors. So if you have a pre-existing health problems, so it could actually affect your sexual experience. Also, many prescription medications. So some of the medications have negative side effects, especially on your sexual health. For example, some medication would cause impotence or erectile dysfunction, and these conditions could greatly affect your sexual activity or your sexual experience. We also have your sexual desire disorders. First, we have your hypoactive sexual desire disorder. This is a deficiency in or absence of sexual fantasies and persistently low interest or a total lack of interest in sexual activity. We also have your sexual aversion disorder. It is a severe distaste for sexual activity or the thought of sexual activity, which then leads to a phobic avoidance of sex. Now let's proceed to your sexual arousal disorder. So refers to the physiological responses and subjective sense of excitement experienced during sexual activity. So we have your female sexual arousal disorder. The lack of vaginal lubrication causes discomfort or pain during sexual intercourse. Also, we have your male erectile dysfunction or disorder, usually made when the man has erection problems during 25% or more of his sexual interactions. Some men can't attain full erection and others lose their erection prior to orgasm. So we have two sexual arousal disorders. That's for both men and women. Now we have your orgasmic disorders. So, female orgasmic disorder simply means that the sexual response stops before orgasm occurs. Male orgasmic disorder, men can maintain an erection for long periods, an hour or more, but have extreme difficulty ejaculating, referred to as retarded ejaculation. So the problem here is not in the erection but on the ejaculation. Okay? So these are the two disorders under your orgasmic disorders. Now, we'll proceed to your sexual pain disorders. So we have here dyspareunia. So it is the pain during or immediately after intercourse. We have also your vaginismus, the involuntary spasm of the outer one-third of the vagina muscles, making penetration of the vagina painful and sometimes impossible. We also have your vulvodynia. Okay, it is a constant and unremitting burning that is localized to the vulva with an acute onset. And lastly, we have your vestibulitis. Causes severe pain only on touch or attempted vaginal entry. Okay, so these are the four conditions under your sexual pain disorders. So problems with satisfaction. So some people experience sexual desire, arousal, and orgasm and yet feel dissatisfied with their sexual relationships, commonly related to the emotional tone of the relationship than to the physiological response. So problems with satisfaction is more of a psychological aspect of individuals. Okay, so they think of something else that could affect their sexual experience. Okay, there is no known physiological problem, but it's more of an emotional or psychological disturbance or problems that causes them to have problems with regards to their sexual satisfaction. Okay, so thank you so much for listening. I hope you learned